Well, hello, my name is 𝗲𝗄𝗂. Today I'm going to talk about the difference between Plan G Medicare supplement and high deductible Plan G. What is this about a high deductible plan? I've been asked for years to do a video about it, but not too many people have come to us saying, I'm so excited I got my high deductible Plan G. What most people do is they do come to us and they say, I want to get off this high deductible Plan G. It seemed like a good idea at the time. And now I want to get back to a regular Medicare supplement plan where I don't have to worry about dealing with claims and dealing with my EOBs all the time. I'll explain to you what happens and why we get into such a predicament. But first, I want to point out that not all agents will talk about high deductible Plan G or even Plan N in a favorable light. They all think that all roads go just to Plan G. Now, I'll grant it. Plan G is the simplest Medicare supplement plan to explain. Why? Because all you have is this very small deductible to meet. In 2024, it'll be $240. So the first $240 of your outpatient costs on Medicare is all you have to pay for the entire calendar year, and then Plan G pays for everything else. What they're not sharing with you is we make a lot more commission if we just leave it there and we don't talk about any other plans. It's the simplest one to explain, so it means our sales process is shorter. And if you put some fear in people, it's called fear, uncertainty, and doubt. It's the most effective way to communicate to somebody that they must take action on your most expensive plan. That's not what we do, but it is what some people do that talk really fast and use a chalkboard. However, we're not going to do that today. We're going to talk about Plan G, high deductible version of Plan G. They share one thing in common, that they both have the letter G in it. Besides that, there's not really much in common. As I mentioned, Plan G covers everything after one part is met, and that is the deductible on Part B, the outpatient part. Now, forget about everything else about Plan G. Now we're going to talk about the high deductible version of Plan G. You have a high deductible amount, and then once you reach that amount, everything's paid for, just like regular old Plan G. However, let me make this very, very simple for you. In 2024, this deductible amount will be 200. No, it's not. Good gracious, it's been a long day already. $2,800 for the whole year. But here's the simple way to understand this, if it'll change for me. Simple explanation is this is not a deductible. It's not treated like a deductible in these plans. It's treated like it's a max out of pocket. So you're going to participate in Medicare as if you had no plan whatsoever. And then when your out of pocket costs reach $2,800 for 2024, and this amount changes every single year, and I'll tell you how that changes every single year because it's important that you know so. But after you reach this max out of pocket, you're done paying until the year runs out, and then it resets all over again. So $2,800 is your max out of pocket on Plan G. $2,800 for the year of 2024. So this thing is just not moving. So you pay 100% of what you normally would have paid under Medicare. Now, some people on YouTube that talk really fast and use a chalkboard say that nothing's paid until you reach this deductible. That is absolutely not true. Let me give you some examples of typical Medicare costs out there. Now, this is what you would experience if you have no Medicare supplement, no Medigap, no Medicare Advantage. You just have Part A, which is inpatient hospital, and you have Part B, which is outpatient services on Medicare. You have both A and B on Medicare. So if you go to an ambulatory surgical center for an MRI, that's what this is. This is from the Medicare website. Let me make it larger so you can see it better. If you go to an ambulatory surgical center, which they prefer you do, then your total cost would be $300, and then Medicare pays $240. They're going to pay the majority of the cost. They have repricing in there. They have a Medicare discount in there. And then of that, you're only going to have to pay 20% of what's left after Medicare's amazing discount. So all you would have to pay for this MRI is $59. Now, these costs vary from different regions in the country, but this is an example from Medicare.gov. And you can see in your area what these things would cost if you just had original Medicare. If you go to a hospital and you want to have that done, we had somebody today that was angry that their Medicare Advantage plan said they can't go to the hospital to have their MRI. They must go to a cheap surgery center. That's just the name of the game with Medicare Advantage. But if you want to go to the hospital and have it done, then your costs go up by $40 or so. Your cost would be $94. So again, on a high deductible plan G, you're paying all the costs just like you had no supplement whatsoever. Medicare's kicking in. They're giving you the deductible or the discount. They're giving you 80% of the cost covered for you. Here's another example. In this, you're having cataract surgery. So if you go to an ambulatory surgery center, it's $117 you'd be paying. If you go to a hospital for an outpatient, $168. One last example, knee surgery. You're having knee surgery and the facility costs $1,414. The doctor costs $553. Total cost $1,967, but Medicare's picking up the vast majority of that bill with their negotiation of the Medicare rate and then paying 80% of it. All you have to pay for the whole thing would be $392. And the good thing, remember, about Medicare, original Medicare, of which the supplements go along with, is you can go to any doctor and any hospital that accepts Medicare across the country. There are no networks. That's one of the biggest positive things about high deductible Plan G, Plan N, all the Medicare supplements is there is no network. You choose your hospital. If you go in the hospital, yes, considerably more on a percentage basis, but still not too crazy for having a knee surgery. Now, on high deductible plan, if you go into the hospital, it's just like you have no supplement whatsoever. And by that, I mean for the year 2024, just to walk in the door on an inpatient basis, you're admitted to the hospital, you're going to have to pay $1,632 just for walking in the door, just as if you had no insurance at all. Now, yes, that will go towards your max out of pocket. Remember, your max out of pocket is $2,800 for the calendar year of 2024. So your $1,600 would put you a long way toward that, but that's per benefit period. What do I mean by that? Well, when you go in the hospital on your Part A costs, first it's $1,632 to walk in the door, but after that, after day 61, and most people don't spend 61 days in the hospital, of course, but after that, you'd be paying $408 per day. After day 91, you'd be paying $816 per day. What people do a lot of is the skilled nursing, though. After 20 days, original Medicare is not going to pay for that for you anymore. You're going to kick in $200 per day in skilled nursing. Now, remember, high deductible Plan G is just as if you had no insurance to go along with original Medicare, and original Medicare is paying what it would do for anybody else. Now, here's the Part B cost that you will be paying if you have no high deductible Plan G, you just have original Medicare, or you do have high deductible Plan G. It doesn't matter. You pay all the cost along with Medicare, enjoying their discounts and their freedom of navigation to go anywhere you want to until you hit that maximum out of pocket, $2,800. So you go into, you go to all the outpatient things you want to, and you're paying 20% of all that. Home health care, you pay 20%. Inpatient hospital care, you're paying 20% of the doctor services while you're in the hospital. Outpatient mental health, you're paying 20%. Inpatient, already talked about that. And then mental health care, you're paying 20% of that. And then outpatient care, you're paying 20% of the Medicare approved amount. So you're getting the Medicare discount. So let me compare one of the second most popular plan out there for Medicare is the Plan N. And this is what we like even more than Plan G in a vast majority of cases because of the rate increase differential between Plan G and Plan N. You put those things side by side, and we often see a 3 to 4 times faster rate increase happening on a Plan G as we do on Plan N. In yesterday's video, I talked about why that is when I talked about all the plan letters. Plan G is an all-you-can-eat buffet. People just pay one deductible, and then they go, and they'll never stop. They can go to the emergency room for their treatment, urgent care, go to any doctor that they want to, go as often as they want to. Medicare is going to pay for it. There's nothing to slow them down. Also, Plan G has to get all the guarantee issue people. If they're getting kicked out of their employer, kicked out of their Medicare Advantage plan, their Medicare Advantage plan's leaving the service area, they move out of the service area because they're moving to another part of the country, all those special enrollment periods, and you can find all the special enrollment periods on Medicare.gov. There are a whole bunch of them. Those trigger guarantee issue, which means they get Plan G. So those people are being shoehorned into Plan G with the agents that are happy to write Plan G are so excited about that because Plan G costs the most premium. That's why the law is set up that way. I wonder who influences the laws. That'd be the insurance lobby. So if the insurance lobby said, oh, we have to take these people, well, can we only give them the most expensive plan, please? And for that reason, Plan G's rate increases go through the roof. Plan N remains stable, because the only way you can get Plan N is if you're new to Medicare and healthy. Generally, most people new to Medicare are, or if you qualify through underwriting questions, about 20 health questions, nothing big. And unlike the fast talking gentleman that I mentioned earlier, who doesn't seem to know much about this plan or that one, the underwriting process is not an intensive process. I'll give you a link below, and at the end of this video, you can see how the underwriting process works. There is no statement from your doctor that's required for you to go through underwriting. You don't have to bother your doctor at all, except in very rare cases. So let's look at Plan N versus high deductible Plan G. Now on Plan N, you have to meet part of Medicare's deductible. It's called the Part B deductible. That's the outpatient stuff. And for the year 2024, that's $240. After you meet $240 on Plan N, you have doctor copays of up to $20. That's the maximum. The typical we see with our patients and our clients, $13 for each copay you go into the doctor's office. Not significant, but that small little roadblock you see will prevent most people from frivolously going into the doctor's office when it's not something that they really didn't need to go for. And you want that if you're participating in the rate increases based specifically on how the utilization is with the population that you are a part of. So if you're in Plan G, real Plan G, and everybody's rushing to the doctor, what does that do to your rate? It goes up. If you have a small speed bump when you go to the doctor and everybody else does too, that prevents people from going to the doctor when they really didn't need to go. And that affects your rate increase too. So let's consider this. The deductible on Plan N, $240. The deductible, which is really a max out of pocket on high deductible Plan G, is $2,800. If you go into the hospital on Plan N, it's a comprehensive plan. You go into the hospital and you don't worry about a thing. It's paid for. You're admitted, it's paid for 100%. Any hospital across the country that you want to go to. If they accept Medicare, which most all of them do, it's $0 to walk in the door. Not so about high deductible Plan G, however. You're going to pay the Part A deductible to walk into the door. And that's per benefit period. So if you're out of the hospital for 60 days, then you go back in, it's another Part A deductible, another same amount. If you're out for 60 days and you go back in again, it's another same amount. Now, if you're in the hospital under observation, typically when you're in the emergency room, they try to do this so it looks better for their rates of readmittance and all that with Medicare. If they try to game the system. If you're just treated in the emergency room and you never leave the emergency room, you're not fully admitted, on Plan N, that's going to cost you a $50 copay to go in the emergency room. Again, this is a small speed bump to prevent abuse of the system, and it keeps the rates low for everybody. I think it's a good thing. On regular Plan G, there is no cost to go in the emergency room, so people use the emergency room as their primary care, and that jacks up the price again. On high deductible Plan G, you can pay all the way up to your max out of pocket on the emergency room. They'll bill you for a facility charge. They'll bill you for the doctor's charges. They'll bill you for supplies. They'll bill you for your blood work. They'll bill you for everything. And you're going to pay that as if it's part of Part B, which is you're paying 20%, baby, all the way up to your max out of pocket. So there's no determining factor as to what you'll actually pay in the emergency room until you just run out of your max out of pocket on high deductible Plan G. Go in the doctor's office on Plan N. Like I mentioned, it's a small copay of up to $20. But if you're going on high deductible Plan G, it's just like on original Medicare with nothing else. You're paying 20% of that bill until you hit your max out of pocket. High deductible Plan G, there are two moving parts you need to be aware of because these do move. One is your monthly premium. They can and they do adjust from time to time, typically one time per year, depending on what state you're in. And then you have this moving target of the annual deductible. Now, the annual deductible is set by Medicare based on the Consumer Price Index. Now, this is the exact Consumer Price Index, and you can see what's been happening with inflation in the last few years. Maybe it's affected you. It sure has affected a lot of people that I know. This is from the Bureau of Labor Statistics. And you'll see that as the increase happens in the urban cost CPI, you're going to see that the deductible is going to go up more and more. As a matter of fact, I think I did a chart on this. Look at this ugly chart that I made. These are the high deductible amounts for Plan G, Plan F high deductible, same exact benefit, same product, same exact thing by a different name. And you'll see that this has started climbing. It's in fact, it's gone up 27% in the last 5 years. And it's probably going to go up a lot more. But you'll just see that For 2024, it's now $2,800. So what I mean is this is a moving target. And sometimes people do get stuck in their Medicare supplement plan because they can't qualify through underwriting to change plans to get out of it. And I mentioned this before, but typically what we hear about high deductible plan G is people will say, I selected that plan. I thought it was going to be a good plan because I don't go to the doctor a lot. I thought I was going to be healthy for the whole time that I'm on Medicare. Oh my gosh, I chose wrong. Can you please put me on plan N, or can you please put me on high deductible plan G? Well, very similar to the same awakening that happens with folks on a Medicare Advantage plan who, when they're turning 65, think, I'll just take a plan that looks just like my employer plan did. You know, I've got a little network. I've got co-payments. What could go wrong with managed care? Then they find out what could go wrong with managed care when they're denied services. They require prior authorization. They require a referral every time you want to go to a specialist. Then they say, get me back to that Medicare supplement you offered me when I was 65. If they were talking to us, if they're talking to most other agents, they were never even offered a Medicare supplement or even told that they exist. But they want to go to a Medicare supplement when they find out that it's out there, probably because their provider will tell them about it. I have a cousin in North Carolina. She's a doctor, and she tells patients all the time when they're starting to have all the trouble with Medicare Advantage, you should have been on a supplement. Let's see if we can help you out. And then she refers those people to us, and we do try to help them. But if you had a bad problem, let's say you have cancer, or you have a degenerative disease, you have spinal stenosis, you have something else that's really bad, rheumatoid arthritis, whatever, and then you're stuck on whatever plan you're on. We can't get you off of a Medicare Advantage plan unless you move out of the service area. Then you get one guarantee issue, like I talked about, but you have to pay for the most expensive one, which is Plan G. But you can't get through underwriting. It's the same thing on high deductible Plan G. You see, if you get on the wrong plan, you can't get off of it. And those are the calls that we typically get, that they settled for a high deductible Plan G, thinking that they can take care of their costs out of their pocket, and then they want to get off of it. Let me give you some rate experience here. People are saying, well, what's the difference in the rate? What does it cost? The rates are different depending on your zip code. And that's why when so many people will send in a comment on YouTube, they'll say, well, why can't you tell me what Plan G costs? Because I don't know if you're a male or a female, what your age is, what your tobacco status is, and what your zip code is. Those are the factors that we have to put in to understand what your particular rate is. So here, I took someone who's new to Medicare, turning 65, a non-smoking female in Mount Pleasant, South Carolina, because that's where we live. You can see here, the high deductible Plan G is only $31 a month. That's a great starting rate. It won't stay there, but it's a great starting rate. Then you have the ever-changing annual deductible, or the max out of pocket. It's been going up, and it will continue to go up with the cost of inflation. Or you have Plan N, which is our preferred plan for a vast majority of people. If you're even relatively healthy, if you go to the doctor less than 10 or 12 times a year, Plan N will probably be your best bet, especially if you compare Plan N to a Plan G, let's say the most popular plan, over a course of being on Medicare for 5 years. Looking at the worst case scenario, let's say you get stuck on a plan. I'd much rather you be stuck on a plan that has a rate increase history of 0 to 3% per year, as opposed to getting stuck on a plan that has a rate increase of 10 to 20% per year, looking at Plan G. So that's just looking at a long-term scenario of what happens if I get stuck on this plan. I want you to be on one that has the lowest propensity for rate increases, historically speaking. And I track those over at PlanNMedicare.org if you ever want to see that. PlanNMedicare.org. See the difference in these two. I'm going to show you some behind the scenes stuff now that'll make many agents mad at me. Anyway, so the difference between Plan N and high deductible Plan G, so for $40 a month, you'd have the peace of mind of knowing that you don't have to deal with the EOBs from Medicare all the time going, wait, did I pay that bill? Did I pay that claim? Because you're going to get statements from doctors all over the place when you're on just original Medicare, and on high deductible Plan G, it's just like you are. You're going to get a bill that you really don't have to pay because it hasn't gone to Medicare yet. Medicare then reprices it. Medicare then pays their 80% of it. Then you get the statement saying, okay, your insurance is done. Now you owe this amount. And then you're over here tracking. Oh, wait, have I met my max out of pocket yet? Have I met my $2,800 for my high deductible Plan G to kick in yet? That's a lot of paperwork to go back and forth. If you don't want to deal with that, then you have a simple Plan N, for instance, and you go in the hospital and you pay nada, zilch, nothing. You go in the hospital again 60 days later, and again, you pay nada, zilch, nothing. And the maximum you can pay on a doctor's visit is $20. Or you have Plan G, which is even more simple, but you're paying a significant premium for that. Now let me show you the rest of the story. You see, this amount is what agents don't want you to see. This is the commission amount that we make on these plans per month for 6 years, 3 years in Michigan, 7 years in Indiana for most companies. But typically 6 years is when your commission runs out on a Medicare supplement if you're a salesperson selling Medicare supplement insurance. Over on those Medicare Advantage plans, by the way, if we put you on that plan and you just stay there, we get paid on that for life, forever. Isn't that crazy? Forever. And it's a lot more commission than this, but I digress. Look, on Plan N, we'd be making $15.80 per month. Of this, it's 22% of that premium amount goes to the agent commission. Whether you went with an agent or you went directly to the insurance company, which you shouldn't do because you don't have an agent, that didn't cost you anything in the first place. You should go through an agent. It feeds families like mine and makes people very happy and offers jobs to wonderful people like these in the Senior Savings Network. But conversely, if you sign up with a Plan G with me, you're going to have to convince me that that is what you absolutely know that you really, really want. Why? Look at the commission that we make. It's 26.37% more commission. Now, this is in my local area. Some places vary. Sometimes it's more. Sometimes it's a little bit less. But this differential is pretty consistent, the difference between Plan G and Plan N. And so if I'm the loud person on the TV all the time, on the YouTube paying for views, and I'm shoving everybody into a funnel and saying, Plan G is the only plan for me. You got to get Plan G. Why would I be doing that? Probably because it's going to pay me 26.3% more commission. Now, if you imagine that, I could have to get 26% less clients and make the same amount of money as I would if I were telling people about Plan N. And by the way, Plan G is super simple to tell people about. You yell at them about a deductible, super fast speak and draw it on the board. You have a deductible and then you're done. Everything's paid at 100%. Go, 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 go. Everybody sell it quick. You don't want that Plan N. It's got those scary excess charges, which is a complete lie and fabrication, scaring people with fear, uncertainty, and doubt. And you got those copays. You don't know what those are going to be. You have to copay everywhere. And that's just going to be crazy, ridiculous. See, if you take the time to explain the benefits and the differences in these plans, and you listen to people to see how often they go to the doctor, then you might determine that the long-term value of putting people where they actually belong will bring you more referrals from people who know that you really care about your clients, instead of just chasing the commission and just chasing the simplicity of saying everything's covered with Plan G. Anyway, I'll get off my high horse for just a minute. So let's compare what happens if you got on a high deductible Plan G. You're paying your $31 a month. Again, this is different depending on where you are and what date you're watching this video. But in my area, this is typical for somebody just starting on Medicare. Or you get on Plan N, which I think is a tremendous value as well, but you don't have to worry about managing all of your claims coming back and forth and wondering if you've hit your max out of pocket quite yet. The difference saved here would be, on this example, $489.60 per year. Seems like a lot of money to save, doesn't it? Well, again, what happens though if you go into the hospital and you pay this amount of money to get into the hospital? Now you've just wiped out your savings with one admission to the hospital. You've wiped out 3.3 years of your savings of $489 just by going into the hospital once. Now, yes, that's a worst case scenario, but that's just one trigger, one thing that can happen. You could have a $2,000 out-of-pocket cost. You could have $2,500 out-of-pocket cost, depending on how sick you are. But most people in Medicare, I'll just share with you, let me level with you. Most people that get on Medicare, when they're first turning 65 or they're in their initial election period, think, I've been healthy. I don't take any drugs. I've never had any major surgeries. I've lived my whole life just taking care of myself. Nothing's going to happen to me. Give me the bare minimum amount of coverage. Everything will be fine. Why do I know this? Because I know tens of thousands of seniors that have been through this exact same scenario. And often they'll take the minimum amount of coverage, maybe the Medicare Advantage plan, maybe the high deductible plan, come full circle. 2 years later, they're coming back saying, can you get me a better plan? Well, what's changed in your health since then? Well, I'm suffering with this. I was diagnosed with this. I have to have this knee replaced. I have to have that cataract surgery. I have to have this hip replaced. I have to have this. Well, if you have pending surgery, that's a no-go. Cannot do it. Cannot do any underwriting of any kind. If you have any chronic condition, chronic diseases, diabetes with complications, for instance, heart problems, No, we can't help from that point. So if you have a middle of the road plan, maybe not basically no coverage and maybe not full coverage for absolutely everything at the highest possible cost and commission, maybe you have one in the middle of the road, then you're not worried about wiping out the savings that you may enjoy if you remain perfectly healthy. I don't know how your crystal ball works, but mine's not that accurate when it comes to what's possibly going to happen in my future, especially between the ages of 65 and 70 years old. Just seems like crazy things happen. This is a figure from this year from the Kaiser Family Foundation, and it shows that the average Medicare household spent on average of $6,557 on healthcare. Now that's talking about if you had original Medicare paying out of your pocket. Now this would not apply if you had high deductible Plan G, granted. And in 2024, this would not apply to you because your stop loss, your max out of pocket would be $2,800. So if you have nothing, at least have high deductible Plan G, at least, and have something that you have a backstop of at least a max out of pocket of $2,800. So you're not just going to pay this out of your pocket and not even know what your costs are going to be. This is some good advice I'm going to give you right here. You need to sign up for, if you've not done so yet, you really need to sign up for MyMedicare.gov. It's the federal site where you can go in there and see what coverages you have, and you can see what claims are coming in for you if you're on original Medicare. You can even see what drugs you're taking on your Part D drug plan. Pretty amazing. You can change your address. You can set up your billing for Part B of Medicare if you're paying that out of your pocket. You can change it from quarterly, which is the default, to monthly if you want to. But you need to see your claims if you're on high deductible Plan G. Why? They're going to send you claims all the time. They're going to send you bills all the time. Do I really have to pay that bill? Has that bill been settled by Medicare? Have they even addressed that bill yet? Don't just pay a statement that comes to you from the doctor under any circumstance from any Medicare supplement unless it's been reviewed by Medicare and reviewed by your insurance to see if you've met your deductible. Don't pay any bill straight from the doctor. Please go on your MyMedicare account and see what the status of that claim is. If you just wait for your statement from Medicare, it's only coming once every 3 months. And by then, something could already be in default. You would probably owe money by that point. So everybody should be on MyMedicare.gov, especially if you're going to be on a high deductible plan, because you need to know the current status of it at all times. Some more information for you. Don't go anywhere. But if you wouldn't mind, please give this video a thumbs up. I'm trying my hardest to put out content that will actually help you. And if you're not yet a subscriber, I really encourage you to subscribe because things change with Medicare all the time. Alerts come out about frauds you need to be aware of, and this information could help you or somebody you love if you want to be in the know about things happening with Medicare. Remember, I'm going now to compare Medicare Advantage to high deductible Plan G, and this is going to get some of you. Remember, when you're on your choice of where am I going to go, original Medicare or Medicare Advantage, the big questions are, do I have network restrictions? Do I have nationwide coverage? Can I go to any hospital? Can I go to any doctor? Do I have prior authorization requirements? Is it guaranteed renewable? Is this plan that I'm signing up for today going to be the same plan I'm going to have for the rest of my life? Well, on high deductible Plan G, because it's original Medicare, it enjoys the benefits of all original Medicare supplements, which is no, there's no network restriction. Yes, there's nationwide coverage, travel at will. If you want to travel, be a nomad, go in the camper, go anywhere across the country, you're free to travel. No problem whatsoever. Is it guaranteed renewable? Yes. Read it in your Medicare and You guidebook. Medicare supplement plans are guaranteed renewable, and the plans won't change unless you stop paying the monthly premium. You put that on bank draft and you don't have to worry about it. Yes, I know bank draft is scary because you have the gas company and the electric company and all the rest that can vary that price. Medicare supplements don't vary every day. They don't change. And that's one premium that you don't want to go unpaid if you are traveling the country. That should be on bank draft for that very reason. You don't want to lose that valuable coverage of your Medicare supplement. Guaranteed renewable. On the Medicare Advantage plans, they change every single year. They can change their network, their copays, what's covered, what's not, their formulary for the drugs, and all the rest. Prior authorization is the biggest problem with Medicare Advantage. I've shown you the videos from the doctors from priorauth.org where they want you to join their petition. The American Medical Association says this is the biggest problem in managed care today is prior authorization and the delays and the denials of care from Medicare Advantage companies. You don't have that with high deductible Plan G. So if you're looking for a cheap premium alternative with a max out of pocket that you can afford, I mean, just think about it. I've seen, we had all the briefings this year on all the Medicare Advantage plans out there because we're actually licensed to sell them. And I can help you with those plans if you want to. Now, we don't represent all the plans in America. You have to go to Medicare.gov to get the Medicare Advantage plans in every single zip code that has every plan out there. You could do that. We don't have that. We've carefully selected which companies and which plans we've chosen to work with. My point was, if you want to look at the Medicare Advantage plans, I'm going to give you a resource in just 1 second where you can go there and see all the plans available to you, and you can pick a plan and you can sign up for a plan, or you can get our help either way. But if you're looking for the freedom to go elsewhere and you're looking at the Medicare Advantage plans and you see that their max out of pocket is sometimes as low as $3,000, sometimes as low as $1,000. More predominantly, you'll see $6,700, $7,000, $8,000, $8,500 as a max out of pocket. And again, you only hit that max out of pocket if you obey everything the managed care says. You go where they say to go, you go when they say to go, you get the treatment prescribed by them. That's the cheapest possible treatment first as an alternative to the expensive treatment. If you follow that course of treatment all the way through, then your max out of pocket applies, and it could be as high as $8,500. Look at a difference of high deductible Plan G, where your max out of pocket is $2,800, but you've got the freedom and flexibility to go absolutely everywhere. This plan requires underwriting if you're not new to Medicare, just like all the Medicare supplements. If you're on high deductible Plan G and you get cancer, you're going to hit your max out of pocket. Just like on Medicare Advantage, you're going to hit your max out of pocket if you have cancer on that plan. So if you're on a high deductible plan, or absolutely any plan, you need cash in case you have cancer. Medicare Advantage plan, I'd say this is non-negotiable. You absolutely have to have cancer coverage because they make you pay 20% of your cancer treatment cost. Did you know that? On your Medicare Advantage, they're going to make you pay 20% of your treatment, just as if you had no plan, just as if you had a high deductible plan. The only difference is they're only going to pay 80% if you go to their facilities, and if you get prior authorization and they approve it and it's in network, then they'll pay 80%. You need cash to address that. We had a lady the other day, we heard about in our Monday morning meeting, that got $40,000 because $40,000 in the cash benefit. This is a diagnosis pay deal. If you get diagnosed, here's your money, and it's tax-free. The reason why she signed up for it is because her friend is on Medicare Advantage and going through this battle right now and cannot believe the amount of money she's having to pay for her cancer treatment. That's to say nothing of paying somebody to come sit with you while you're going through the treatment, or traveling somewhere so you can get better treatment. Everybody needs to look at this and the benefits of cancer. You can do that at our website called cancerplan.us. I encourage you to. Now, this is something that came out just literally today. Terry Savage is a columnist with the Chicago Tribune. Had a question submitted to Terry. Let me see if I can make it larger for you to see. I went on Medicare at the end of 2016 with Mutual of Omaha and Silver Script, which is a Part D drug plan. I was on that plan until 2019. January of 2020, I transferred to the AARP Medicare Advantage drug plan included, otherwise known as MAPD plan. Last January, I had a colonoscopy, and the doctor's office said I could not do that at the hospital, only the surgical center. We talked about that before, didn't we? She wants to go to the hospital. When the doctor's office called about the surgical center, I asked if this was typical, and she said, yes, for your Advantage plan, cheapest is better. My concern is, Advantage plan, is it good for the future? If it is advised to go back on, can I go back on to Medicare with a supplement plan, or is one on the Advantage plan the rest of your life? And Terry answers this question wrong. God bless him. And Terry says, wait, no, it's not for the rest of your life. And if you want a doctor to control your health care instead of the plan administrator, this is the time to switch back to original Medicare plus a supplement. It's half right. It's almost right. Let's see. Now's the time to switch back to original Medicare plus a supplement and Part D for drugs. Open enrollment runs from now until December 15th. No, it doesn't. Go to Medicare.gov to apply for a supplement and Part D. What? When you switch back to original Medicare. 3 things that are wrong here, and I just caught the last one. First, open enrollment is not open enrollment. That's BS. That's only for going from a Medicare Advantage to a Medicare Advantage to a Medicare Advantage. It's not December 15th. That's like one party said the date for your party to vote is November 4th. No, ding dong. It's December 7th, Pearl Harbor Day, my birthday. You should know that. That's why I was born when I was born, for just such a time as this, because Medicare is my life. No, December 7th is my birthday, but it is the end of the annual election period for what you want to do. And you can't go to Medicare.gov and buy a supplement. You can't. All Medicare.gov is going to show you and help you enroll with Plan Finder is a Medicare Advantage plan or Part D plan. For a supplement, you've got to go to an insurance agent or go directly to an insurance company. You cannot go to Medicare. Okay, and here's another thing that's wrong. You can't just say, I want a Medicare supplement, get me off this Advantage plan. Can't do it. If you want to go to a Medicare supplement, you have to do it in a methodical way that we break down on our website that you can see very, very easy. You go to our website, you click on yes, give me help. And what's your scenario? You're on a Medicare Advantage plan and you want to go to a Medicare supplement. Here are the steps. First, apply for an underwritten Medicare supplement plan. How do you do that? I'm glad you asked. On this website right here, Underwritten Medigap. This page is a video explaining the underwriting process. It's not complicated. It does not require a doctor's permission or a doctor's note or a doctor's inquiry whatsoever. Very simple, and I explain it there. And then you can sign up for an appointment, or we can help you get through that process. So again, here's the steps, right? You want to go from a Medicare Advantage plan to a Medicare supplement of any kind. High deductible Plan G, Plan N, Plan G. All the underwriting is the same, regardless of which plan letter you wish to apply for. There's not one underwriting for a Plan G and a different underwriting for a Plan N. If you're going underwritten and not guarantee issue, all the questions are the same. It is a pass-fail game. You either pass it and you're approved, and now about 90% of the insurance companies we deal with will give you an instant approval, which is fantastic. But if you take the advice of the columnist and not the licensed insurance agent, you'll say, let me call up my Medicare Advantage plan and say, look, cancel me. I'm going back to original Medicare. Cancel my Advantage plan for January 1st. I'm out. And then you go apply for a Medicare supplement through underwriting and you don't get approved. Number one, you didn't work for an agent. You didn't go through an agent who knows what your conditions are, because you're hopefully honest with them. And they find a Medicare supplement company that will take you based on your conditions, or gracefully tell you that you just can't apply because there's no way in the world that you would be approved based on a certain condition. Or, like many people tell me, I've got high blood pressure. Oh, I've got high cholesterol. Do you think I'll make it? Yes, you'll make it all day long. It's very, very simple. There are just a few things that you can have that you won't be approved. Some of those things have a time condition on it. You had a stent? That's okay. Wait 2 or 3 years, depending on which company. Have you had cancer? That's okay. Wait 3 or 5 years, depending on the company and which type of cancer. We know those things. That's why we're an independent brokerage. We work with different companies that will approve you based on different criteria. That's not all the same. That's why we know underwriting. I started my first 10 years in this business of doing nothing but underwriting, becoming a field underwriter, so that I know the difference between, yes, you will be approved, don't bother applying, or I've got this little company over here that's not advertising on the Goodyear blimp during the Super Bowl. They don't do a lot of advertising, but they'll take your condition and we can get you in there and save you a lot of money on your Medicare supplement. That's how I started my whole career. Not just everybody chasing turning 65 people and just signing them up like most agents do. Anyway, so if you're going from Medicare Advantage to Medicare supplement, apply for underwriting first on the supplement. Once you get approved for a January 1 start date, then you apply for a Part D drug plan, standalone drug plan, customized for you, not just packaged in your Medicare Advantage plan, a customized Part D plan, which you can do at our website called startpartd.com. And then and only then, your Advantage plan will cancel automatically on January 1st. But do not run to your Advantage plan and say, I want to get off your plan because I don't like you anymore. Not a good move if you don't have a backup plan. And if you're not 100% sure you're approved yet, we have a system. We'll walk you through it. You don't want to do it wrong. You don't want to go through an agent who does not do this every single day like we do. If you want to look at Medicare Advantage options near you, by all means, use our website. You can either do it yourself. You can look at the plans. You can sign up with your plans. It's a CMS approved direct-to-consumer website that has, according to CMS, all the information, all the disclosures, everything you need to know to make an informed choice. The website's been approved by CMS. Go to MedicareAdvantageNearMe.com, Or if you go there and you're like, you know what, I need some help, I need somebody to guide me. If we're still in, when you're watching this, still in the annual election period of October 15th through December 7th, and if there's time on our calendar, you can sign up for an appointment with us. Those times are running out quick. We're already into November, and it's only October the 24th as I'm making this. If you want to change your Medicare supplement plan, just to go from one supplement to another, let's say you're on Plan G, you want to go to a high deductible Plan G, please don't do that during the annual enrollment period. Why? Because 50 million people are trying to change their Medicare Advantage plan. That's a slight exaggeration, probably 23 million. And there are only a finite number of insurance agents. So many insurance agents are age 60 and 70 and the like, and they're retiring right now. I have to turn my fan on. It's getting warm in here. Woo! There are less and less and less of us to help more and more and more people. And the government has compressed this annual election period down to 54 days. So we have all these people on Medicare Advantage that want to get off of it or change or get onto it. It's all about Medicare Advantage right now. It's not about you if you're on a Medicare supplement. Please pick a day after December 7th, and we can go from all the Medicare supplements you want to, all over. Shop your plan. If you're getting a renewal, you're getting a rate increase, shop the market. We can change your Medicare supplement plan 365 days a year. Look at the underwriting process. Cancerplan.us is becoming a very popular thing. We're helping a lot of people with cancer insurance that did not even know it exists. Again, as a caveat, lots and lots of our clients are in California. California requires that you have to stop being able to buy cancer insurance once you turn 65. Makes no sense, but you can buy a cancer plan in California from the age of 18 to 64. That's it. So if you're getting new to Medicare, you're about to turn 65 in California, you better lock in your cancer plan then. Those plans too are guaranteed renewable for life. That's a great thing. Medicare on disability. Have a lot of people who are under 65 years old. They're on Medicare due to the fact that they were on Social Security disability for 2 years. Once you're on Social Security disability for 2 years, you automatically qualify for Medicare, and they're wondering, what do I do for a supplement? There are only a handful of states where we can help you with a Medicare supplement. That's dictated entirely by the state law, because Medicare Advantage is run through Washington, D.C. Medicare supplements are run on a state-by-state basis, different rules. If you go to my website called MedicareOnDisability.com, watch the video there. It explains the places where we can help you and the places where you'll have to get a Medicare Advantage plan. But fear not. If you get a Medicare Advantage plan, you have the same types of Medicare Advantage plans available to everybody 65 and over. And the best news is, once you do turn 65, you get what they call IEP2, your initial election period, version 2, a do-over for your open enrollment. So you can get a Medicare supplement plan just as if you're a brand new baby to Medicare, 65 years old, the cheapest rates in the industry. So go to MedicareOnDisability.com if you're under 65 and you're on Medicare and you're wondering what those options are. This is probably hundreds of comments every week from people that are under 65 saying, there's nothing for me to do. There's nothing available for me. There may be, and the video there on that website will explain what those options are to you. Woo, it's a lot of work to put this stuff together. Our website, if you go there, at the top there, SeniorSavingsNetwork.org, there is a help button, Medicare Help. If you click that, you'll see different scenarios, or if none of those scenarios fit you, just fill out the form that's on the page and we'll reach out to you as soon as we can. As of yesterday, we're 280 people behind from calling people back. We're doing our level best with all the people that we have in here. We're trying to prioritize those people who have to have a plan by the end of the month, those people who have to switch their Medicare Advantage plan, those people who have to get off their Medicare Advantage plan and get into underwriting queue just as fast as possible. So we're doing as much triage. If you call our number and you say, hi, my name is Mary Jane, and I live in 77402 zip code, have a great day. We don't know how to prioritize that. We don't know how to triage it. So if you're calling our phone number, please tell us why you're calling. Tell us what your situation is so we can do our level best to get you into our system. By calling our phone number, you're allowing us to send you a text message. Why is that? Because when I have 20 people working the phones and working their computers just as fast as they can, and there's some type of clarity that we need, then they can shoot you a text message and say, what can I help you with? Can I direct you to a resource or get you on our calendar? It's so much easier than try to pick up the phone and call out. We're having 3 calls come in at the exact same time, and we can't pick up the phone to call you. We have no idea why you called in. So if you're calling in, First, I encourage you to go to the website, pick what you need to find on the website, get the video education on what that option is and what the parts are involved in it, then fill out the form and it'll put you right on our calendar at a time convenient for you, so we won't miss our appointment with you. That's the easiest way possible. Pick your own date and time rather than get the human involved and you leaving a message, we miss you because you don't know our caller ID, calling from area code 843, by the way. You'd miss us, we'll miss you. But if you do call and leave a message, please help us to help you by telling us what it is that you're calling about so we can help you the best. And leave your phone number. A lot of people say, you've got my phone number, click, and they hang up, and they don't realize that they're blocking their outbound phone number, and it says private on our end. And no, we don't have your phone number. If you just, as a courtesy, leave us your phone number in the voicemail and tell us your name, where you are, and what we can do to help you, then we'll do our very best to help you. Thank you so much for watching. I'm exhausted. I'm going home finally. God bless you, and I hope your annual election period is a lot less stressful than ours. But we're here to help everybody. We're doing the level best that we can. I hope you have a wonderful day. Thank you so much for watching my videos, and make sure you stay tuned because stuff is changing with Medicare all the time.